Parental nutrition in critically ill children. Definition Introduction. Parental nutrition is the feeding of a person intravenously, bypassing the usual process of eating and digestion. The person receives nutritional formulae that contain nutrients such as glucose, salts, amino acids, lipids, and added vitamins and dietary minerals.
After a few days of critical illness, children develop profound macronutrient deficiency, which may be associated with infections, delayed recovery, and prolonged mechanical ventilation. Enteral nutrition is the preferred method of meeting the macronutrient requirement. If enteral feeding is not possible, however, or fails, parenteral nutrition is advised. But evidence to support the timing and benefit of parenteral nutrition in critically ill children is lacking. In a multi-center study, 1,440 critically ill children from newborn to 17 years old, with 45% under 1 year old, who were admitted to the pediatric intensive care unit and at risk for malnutrition, were randomly assigned to either early or late parenteral nutrition. Early enteral nutrition was attempted in all patients, and they all received intravenous micronutrients and a similar volume of fluid. Analyses of the co-primary outcomes demonstrated that patients who received late parenteral nutrition were less likely to acquire new infections while in the intensive care unit, and needed intensive care for less time. The mortality rates across predefined time periods did not differ significantly between groups. There were significantly more hypoglycemic events in the patients in the late parenteral nutrition group. Thus, withholding parenteral nutrition for 1 week in critically ill children in the pediatric intensive care unit, as compared with initiating early parenteral nutrition, is clinically superior, with fewer new infections and a shorter stay in the intensive care unit. Full trial results are available at nejm.org.
Applications in medicine. Total parenteral nutrition is provided when the gastrointestinal tract is not functional because of an interruption in its continuity, or because its absorptive capacity is impaired. It has been used for comatose patients, although enteral feeding is usually preferable and less prone to complications. Parental nutrition is used to prevent malnutrition in patients who are unable to obtain adequate nutrients by oral or enteral routes.
Let's start with the question that most people have. What is an enteral feeding tube? An enteral feeding tube allows liquid food to enter your stomach or intestine through a soft, flexible tube. A tube inserted in the stomach is called a gastrostomy or G-tube. A tube inserted in the stomach but ends in the small intestine is called a jejunostomy or J-tube. The site on the abdomen where the tube is inserted is called a stoma. The location of the stoma depends on your specific operation and the shape of your abdomen. Most stomas lie flat against your body and are round in shape. Conditions such as cancer, trauma, nervous system, and digestive system disorders can affect your ability to eat and require a feeding tube either temporarily or permanently. Let's review your digestive system so you understand a little more about the feeding tube. When food enters the mouth, the lips and tongue move it toward the back of the throat. Food moves into the esophagus and into the stomach. The opening at the top of the esophagus tightens to keep food from entering the airway or trachea. Food travels from the stomach into the small intestine, where enzymes break down food into thick liquid. The liquid then passes through the large intestine or colon and eventually moves out through the rectum. Most gastrostomy tubes have an anchoring device on the inside of the stomach and an external device. This secures the tube in the stomach. A percutaneous gastrostomy tube, PEG, or percutaneous gastrojejunostomy tube, PGJ, is held in place with a mushroom-shaped device on the inside of the stomach. A PEG tube or PEG button may be a short or a long tube that extends out of the stoma about 12 inches. A PGJ tube ends in the small intestine. A skin-level gastrostomy tube or gastric button lies flat on the surface of the abdomen. The button is opened during feedings, and an extension tube twists and locks into the opening. The button is held in place with a water-filled balloon that sits inside the abdomen. When feedings need to bypass the mouth, esophagus, and stomach, a feeding tube is inserted into the jejunum or small intestine. Gastrojejunal or GJ tubes are surgically placed through the abdominal wall into the stomach, with the feeding tube ending in the jejunum. Most GJ tubes have a separate gastric port to access the stomach for venting and some medications. The port marked jejunal is used for the feeding. GJ tubes are available both as long tubes or low-profile buttons. A jejunostomy or J tube is inserted by making a surgical incision on the surface of the abdomen, with the tube placed directly into the jejunum. A fixation device holds the tube in place. Jejunal feedings are given continuously. The feeding may be started slowly, and the rate increased as tolerated.
Pros and cons. Pros. Short-term PN may be used if a person's digestive system has shut down, and they are at low enough weight to cause concern about nutrition during an extended hospital stay. Long-term PN is occasionally used to treat people suffering the extreme consequences of an accident, surgery, or digestive disorder. PN has extended the life of children born with non-existent or severely deformed organs. Cons. Possible complications: infection, blood clots, fatty liver and liver failure, hunger, cholecystitis, gut atrophy.
I'm Dr. Dan, talking from Vitamin Pro, and I want to discuss a little bit about the difference between nutritional support and pharmaceutical intervention. And it's because we get this kind of question, such as maybe we're going to offer some kind of adrenal support, and then it's natural. So you certainly can get addicted to these kinds of pharmaceuticals. Now, if we give you Cabanase, maybe some Trabacor or Serene or something like that in order to help you sleep, you're not going to become addicted to these. These are just giving your body the building blocks that it would normally need in order to produce that healthy sleep state. So if we recommend supplements, not to worry. These are not going to become an addictive state. They're not going to damage the organ. They're actually going to help the organ function more at its normal pace. But now, this is one reason why we like testing, because we can do a test, we can supplement, and then we can repeat the test, and we can see that your body's going back into more normal range. So that's the difference between pharmaceutical intervention and nutritional support. So hopefully that answers that question for you, and you can understand why the nutritional industry in the United States is one of the safest industries in history. There just aren't a lot of bad things to say about this type of support when it's properly applied. So that's that topic. Hopefully that was helpful for you. Thanks a lot for listening.
Issue apply in Ecuador. In Ecuador, the rate of malnutrition declines by 18 points in the last 20 years.
Hi, my name is Dr. Tanya Hoffmeckler, and I'm the current Director of Intestinal Rehab of Children's at Eggleston Hospital in Atlanta. And I'm going to talk to you today about intestinal failure and G-tubes. So first, let's answer, what is intestinal failure? Intestinal failure occurs in children whenever their intestinal tract does not function enough so that they can either grow or stay hydrated by using their regular GI tract. So intestinal failure can happen if, for example, a large section of the intestines is removed and then a child has something called short gut syndrome. Or if for some reason the intestinal tract simply does not function the way we expect it to function. This may mean the intestinal tract does not move food through it properly, and so the child can have an underlying motility problem. Or if, for example, the intestinal tract does not absorb the proper nutrition through it, and then the child may have diarrhea or simply cannot grow and thrive by using their intestinal tract or relying solely on the intestinal tract. So before we speak about G-tubes, I want to talk about parenteral nutrition very quickly. So whenever a child has intestinal failure, we as physicians have to rely on something other than their intestinal tract to provide the nutrition and hydration and calories. So that comes through parenteral nutrition. Parenteral nutrition is essentially calories and fluids that we can give by an IV to the child or to whoever needs
it. Conclusion. Many people use TPN at home in the United States, and because TPNs require anywhere from 10 to 16 hours to be administered, daily life can be affected. Although daily lifestyle can be changed, most patients agree that these changes are better than staying at the hospital. Many different types of pumps exist to limit the time the patient is hooked up. Usually a backpack pump is used, allowing for mobility. The time required to be connected to the IV is dependent on the situation of each patient. Some require once a day or 5 days a week.